Good afternoon all. So this is week 3, very exciting week it's been. So of course there was we lost the rugby by a very small margin in the last few seconds of the game with that drop kick. That was very unfortunate. Then of course Sunday we were into Cillian Murphy and his wonderful win at the Oscars. That was so great to see that film and so many people from Ireland getting some honours there. Monday was a very exciting day for me. So we held the first meeting of the integrated leadership team, so bringing the community and the hospital and public health together. And we had 2 really important issues to talk about on Monday. The first was the construction of the clinical governance team. So who should be around the table from the professions, from the clinical professions. And it was very much a unanimous thought that we needed allied health people, so health and social care professionals, as well as medical professionals and nursing professionals around the table. And we'll make that submission to National for their consideration. Second really important thing we discussed was the makeup of the integrated healthcare areas. And the proposal that had been put to us centrally was to have Kerry as an area and then Cork divided into north and south. That doesn't work for us because Kerry would then be a relatively small IHA, and north and south really ignore some of the important integration work and flows that have happened so far. So I've just come off a call where I've made a recommendation that we have Kerry and West Cork as an IHA and Central Cork as another IHA, and we'll put that to the national team for their consideration and get back to you with a decision as soon as possible. That brings me to how we're going to recruit to the entirety of the regional management team. We're hoping to make that sooner rather than later. I outed that last week, so hopefully we'll get the ball moving and give people the clarity that you need very quickly. Tuesday I was really honoured to be with the Child and Adolescent Mental Health Services for their collaboration day, and I was just struck by the positivity, by the strengths there are in that team and how robust and resilient they've been despite a lot of issues. One of the things I want to work on with them is the waiting times for patients, very long waiting times, and we need to be very ambitious in trying to resolve those. But a great day, and I was humbled to be in the presence of so many people trying to make such a big difference to children and their families. So then on Wednesday I was in Kerry, and it was a repeat visit to Kerry. I had an opportunity to spend more time with clinical people in Kerry and look at some of the challenges they face at UHK, so we'll be putting a lot of effort into that. And of course the people waiting on trolleys I saw firsthand, and none of us would want to see that. It really is very unpleasant to see our community waiting on trolleys, so I'll be working on a plan with the colleagues in both community and hospital to try and move that on. And then Thursday, Cork University Hospital. I've had a great reception. We've been working on some of the flow issues, saw a great team in ED, just the sort of culture that we need across the organisation. Really a team of professionals who have put the absolute best practice in place, and really just we need to sort out the flow through the hospitals. So unfortunately for me, my father-in-law died a couple of weeks ago, so I'm away to his funeral over the weekend, but I'd just like to wish all of you a very happy St. Patrick's Day.